So yesterday we started about hypertension. So initially we discussed that we have acute and chronic condition. Again, in acute or chronic both that they may be primary or secondary. So we discussed about primary hypertension, and today we will discuss about secondary hypertension. This is very important, and most of the cases the person belongs to secondary hypertension. Means there is any underlying disorder, underlying disorder. There is a reason behind the issues. First, what are the underlying disorders? It may be direct involvement of cardiovascular. So we'll call cardiovascular hypertension. Okay. Like one reason is atherosclerosis, means there is any clot or any deposition of fat in the vessel. Okay. Atherosclerosis means if it is the blood vessel, there is a blood flow easily. Any blood vessel, we have fat deposition gradually increase. So means here you need more pressure to go blood outside or outside that area. Okay. So there's the reason you have hypertension. Next is iota. We'll call correlation of iota. Okay. Correlation of iota means narrowing of iota. Means the vessels, it much space is there, but it will the space between the blood vessels will decrease. Okay. So here in the secondary hypertension, the first cause may be the hypertension due to the cardiovascular disease. Okay, it may be any clot or any uh, clot means fat deposition or any damage of narrowing of aorta. Okay. Next is second reason is endocrine hypertension. The hypertension due to the endocrine system. What may be the reasons we will discuss in detail here. One is any tumor in the medulla or adrenal gland or any issue in the adrenal gland. Okay. And second is the excess release of aldosterone, hyperaldosteronism. Okay. Aldosterone is an hormone. Okay. The is produced by the adrenal gland, adrenal cortex mostly. So aldosterone hypersecretion. Okay. It is my one of the reason. And third is any syndrome. Due to that, more hormones are releasing from the adrenal cortex. Okay. So mostly here in the endocrine system, the adrenal gland is involved. Okay. Due to that reason, the patient have hypertension. So in the secondary, first involvement is cardiovascular disease, and then second involvement is endocrine system. Next, third. In the third, we have renal, means here kidney involvement, renal hypertension. What may be the reasons? The arteries that are bringing the blood to the kidney, or the arteries that taking blood, refined blood from the kidney, both may become narrow. Their space is decreased. Okay. First thing is that, or any issue in the glomerular or nephritis, anything. Okay. Due to that, BP maybe increase, sometimes decrease also. Or okay, direct involve of cell of the kidney or the other related things of kidney. So these are the two reasons, the because that the BP is increasing. So first is cardiovascular disease, second is endocrine disease, third is renal disease, and the fourth important disease reason, that is nervous involvement. Okay, means nervous here, brain involvement, nervous hypertension. In here, any pressure increase in the brain, intracranial pressure increased due to the any trauma, due to the accident, due to the clot, due to the hemorrhage, etc., or any lesion or tumor in the brain, okay, or carotid, vessels are stenosed, or any fat deposited in carotid artery, okay, direct involvement of brain or pressure increased or involvement of artery. So you will get the nervous hypertension. Okay. One type of hypertension that that is pregnancy during hypertension. Okay. Hypertension during pregnancy. Okay. It is also one of the a scenery thing that due to the eclampsia, bleeding, excess bleeding, or internal bleeding, or convulsion, epilepsy of the things. Okay. Okay. Or concentration or contraction of placenta, damage of placenta without coming to the normal, means 9 month pregnancy before 38 weeks. Okay. So this is called, we have the reason behind the hypertension. So what we have that in the hypertension treatment option. So first we will go to the symptoms, clinical symptoms we have in hypertension. So what are the clinical symptoms the patient will tell you, or you can observe that mostly the patient have headache, okay, and giddiness, okay, and you have fatigue, weakness also in some cases, or irritability, lack of concentration. Some patient have drowsiness, blurred vision if there is a lot of high BP. Okay. Okay. So these are the common symptoms you can see in the hypertension. Mostly headache. The patient will tell you the headache. I have severe headache. Okay. Throbbing pain in the headache, and his face becomes red. Okay. He unable to concentrate on anything. Okay. So you have to see all these symptoms. Okay. And what are the basic tests you have to do? First is, because if you, the direct involvement of cardiovascular disease, you need to see the cholesterol level. You have to do lipid profile of the patient. Secondly, may need to re-echo to see the size of iota. Okay. If the involvement of endocrine system, you need to see the corticosteroid levels or how the adrenal gland is function. Sometimes you need ultrasonography of pelvic. lesion to see the size of the adrenal gland and kidney, etc., etc. If the involvement of kidney, you need to see the liver function test, how the creatinine is there, how the blood urea is there, how the sodium, potassium levels are there, fluoride levels are there, calcium, phosphorus levels, everything you need to check up. If the involvement of nervous, the patient will need to do the CT brain sometime if the severe headache is there with nervous CNS symptoms, okay, weakness of the limbs or facial paralysis, anything, prolonged headache, need to evaluate by doing CT brain. So, upon asking the symptoms and the reason behind the hypertension, may be required to do the actual tests. Okay. So, what is the treatment plan? So, we need to evaluate what is the reason behind the hypertension. Initially, you can give the patient, if the hypertension is associated with stress, sleeplessness, any emotional issues, not directly, not secondary hypertension. Secondary hypertension need test and evaluation and proper diagnosis, then only you can treat easily. Primary hypertension can be treated easily. Okay. In that, mostly benign hypertension. So what is the prescription for primary hypertension or primary hypertension? Okay. In that we have S10, A1Y. You need to gain D6 or Y apply application. If the involvement of direct heart, okay, and you have another remedy for metabolism S10 C1W, and another one is S5A3B. Okay, so to improve the metabolism, okay, you can give in D5. So this is the main remedy. These two are remedies are for hypertension. So if the hypertension patient is recovered well, you need to evaluate all these things: kidney, okay, heart, okay, adrenal cortex, and nervous system or endocrine system. All these systems to be evaluated and treat the patient according to the condition. Okay. So this is all about hypertension discussed in detail. Okay. If any doubts, kindly ask.